Well, good morning, everyone. It's great to see you here this morning. I'm Les Hall. I'm the interim dean of the University of Missouri School of Medicine. I want to thank you for joining us today as we announce a major federal grant that MU has received to research ways to advance healthcare throughout the United States. This $4.5 million grant has been awarded to MU from the U.S. Department of Health and Human Services Agency for Healthcare Research and Quality. That's a mouthful, which is commonly known as AHRQ, or AHRQ. MU is only one of only 7 institutions in the country to receive this grant for researching methods to improve patient health outcomes. This grant will support the creation of a multidisciplinary MU Center for Patient-Centered Outcomes Research, which will bring together experts from numerous fields across campus, from the MU Health System, the School of Medicine, School of Nursing, School of Health Professions, ranging all the way to the School of Journalism. And together these researchers will work to develop better models of healthcare designed to improve the health of our patients. This research is centered upon a principle or a concept known as patient-centered outcomes. It's an idea that health services researchers and clinicians are increasingly focused on here at MU and across the country. In short, it's about putting patients at the heart of everything we do as healthcare professionals. Historically, healthcare is focused on solving problems. If a patient breaks his leg, you mend it. If someone has an infection, you treat it. If they have cancer, you fight it. But over the last several decades, healthcare has changed immensely. We've been facing challenges we never imagined before. Patients are surviving conditions that 50 years ago would have been unthinkable. And because of that, many patients today face healthcare challenges that are very complex. We're also facing new opportunities that stem out of the success of medical innovation for the past century. Advances in healthcare technologies and treatments mean we have countless more tools today than we've had in the past, because the health challenges facing Americans today are so much more complex and the number of treatments to offer to them are so vast. It provides patients and healthcareers with a new luxury, which is options to choose from. With this grant, the University of Missouri is forging a new path for the future of healthcare in our country. We want to make the best of having these choices. So at its heart, the concept of patient-centered outcomes is about making patients active members of their healthcare teams, which is a concept that we all can embrace and are very excited about. It's about teaching health professionals to ask patients what their healthcare goals are, engaging those patients in discussions about their treatment options, and then empowering those patients to make good decisions about their health. So one example of that is one research project which will be funded by this AHRQ grant, which investigates the different treatments that are available for patients who have poor circulations in their arms or their legs, which place them at risk for amputations. Dr. Todd Vogel, who is one of our vascular surgeons at University Hospital and a member of our faculty in the School of Medicine, is going to study differences between minimally invasive and traditional open surgery for treatment of these conditions. With the result of that study, doctors can discuss the benefits of the different options with patients, helping them to make better informed decisions for themselves. So as I mentioned a few moments ago, innovative research of this kind requires a whole range of expertise and good collaboration between those individuals and schools. To speak more about this grant, we will have, over the course of the next few minutes, speakers from the schools involved in this project: the School of Medicine, Sinclair School of Nursing, School of Health Professions, and the School of Journalism. But first, I'd like to introduce Interim Chancellor of the University of Missouri, Steve Owens, to talk about what this grant says about MU. Steve.
Well, thank you, Dr. Hall. I want to thank you all for inviting me to be here today. I'm proud to be here today because this grant represents some of what the University of Missouri does best, bringing faculty together from different disciplines to investigate and solve problems. This grant from AHRQ is significant because it will expand the capacity of the university to focus on research to improve outcomes for patients everywhere. It is a perfect example of how we are fulfilling our mission at MU to produce and disseminate knowledge that will improve the quality of life in the state, the nation, and indeed the world. MU is truly one of the best universities in the country for a research grant such as this one. Patient-centered outcomes is a field of study that exists at the intersection of research and patient care. Here in Columbia, we have a premier academic medical center in MU Healthcare, as well as the MU schools of health professions, nursing, and medicine, all located on one campus. With the addition of the health communications researchers from our School of Journalism, it becomes clear that our university is the ideal institution for this research designed to improve patient outcomes. The University of Missouri's reputation for multidisciplinary research is key to securing highly competitive grants such as this one. Our faculty collaborates with ease across campus, developing innovations designed to improve the lives of people within and beyond the boundaries of our state. That cross-pollination of ideas and expertise makes MU a fertile environment for discovery. At some point in our lives, we will all require medical treatment, and we can anticipate this inevitability as we age. So I want to thank all of the members of the research team for your efforts to improve patient care for all of us, and congratulations on securing this significant research grant that says so much about who we are here at Missouri. Thank you.
Thank you, Steve. I'd now like to introduce Dr. Glenn Cameron, who is a professor in the Maxine Wilson Gregory Chair in Journalism Research at the University of Missouri. Glenn also has a joint appointment in the MU School of Medicine's Department of Family and Community Medicine to study patient-centered outcomes. Dr. Cameron.
Thank you, Dr. Hall. I want to thank you and Dr. David Mayer for inviting me to speak today. I'm proud to be here today because this grant represents some of the University of Missouri's greatest strengths as described by both of the speakers. We bring together faculty from different disciplines to investigate and solve. Oh, I've got the wrong, I need to flip the page. Didn't sound like what I wrote last night. Representing the School of Journalism as well as my Health Communication Research Center and the work of the MU Center for PCOR. I must say that I'm particularly excited to play a role in a terrific team led by Dr. Mayer, a team that already makes wintry 8 a.m. committee meetings a fun event. And some of the people here know who they are. I've never enjoyed as many laughs at supposedly serious meetings as I have already working with our core group. We're on the same page with a common goal and having a good time in the process of doing that. I will lead a J-School group to bring a cutting-edge mobile health app to bear on the challenge of creating a constructive communication environment that improves patient outcomes. So our role will be to try to facilitate a knitting together of all of the various players in this complex new medical environment. The mobile app is the culmination of over a decade of NIH-funded research from the Cancer and Diabetes Institutes, complemented by acceleration funding from the Reynolds Journalism Institute. That research and development enables us now to create health news stories tailored to the individual patient and to the patient's circle of care. The app, called Treeple, and for those who are writing this down, double E and double P, will serve as a communication platform, but also as a research tool for the center. So it kind of has a dual role. And in the process, Treeple will grow and change to better meet real needs of patients and caregivers in the complex modern healthcare setting so clearly described by Dr. Hall. The challenges in reaching and engaging patients dealing with their own health conditions are great. But I believe there is not a better place in the U.S. to build the capacity to, number one, create health news that patients can really use because it is personally relevant to them. Two, to link patients to their family, friends, and caregivers who can support their journey toward recovery. And three, to provide reminders and personal record functions that help patients participate in their own positive health outcomes. Again, I'm delighted to bring my research program in health communication to bear on the goals of the center. I imagine a day when patients and their supporters better manage pain or fully recover from vascular surgery. And we can all relate to seeing our parents, grandparents, uncles, aunts, successfully return from hospitalization to home. At my age, I can see it making a difference to me personally in the not-so-distant future. Thank you. And I'll flip the page.
Thank you, Glenn. I'd now like to introduce Dr. Janet Farmer, who is the Interim Associate Dean of Research at the University of Missouri School of Health Professions, and is also a professor of health psychology at the school and a professor in the Department of Child Health at the MU School of Medicine.
Thank you, Dr. Hall, and of course, Dr. Mayer, for inviting me to speak and represent the School of Health Professions today. The School of Health Professions is really pleased to have this opportunity to participate in this exciting grant. It will certainly enhance our faculty's ability to continue to advance evidence-based care for the patients we serve. The school's health professions account for more than 60% of the total U.S. Healthcare workforce. That may surprise you. It actually did me at first, but it's a fact. These professionals include speech-language pathologists, occupational therapists, physical therapists, psychologists, respiratory therapists, and cardiopulmonary diagnostic specialists, among others. Several of these are actually the fastest growing professions in the U.S. today, which accounts for what many of you know, the rapid growth in the School of Health Professions. We're just treading water trying to keep up with the growth in our school. I'm very excited about the educational and research opportunities that we have because of that. The new grant will promote further growth in the faculty's ability to develop and collaborate in important interdisciplinary research. One of our researchers, Dr. Victoria Schaefer, is at the forefront of developing new strategies to help patients make medical decisions, and she has already been involved in projects related to the grant. Other researchers can contribute to improving the health and well-being of individuals with chronic health conditions across the lifespan. For example, we have researchers right now who are heavily engaged in working with children with autism and other developmental disorders. We have researchers who are working with adults with chronic conditions such as diabetes, traumatic brain injury, spinal cord injury, ALS, and HIV/AIDS, plus many others. Then there's our researchers who work with aging populations. This includes a major effort, already collaborative, to work to improve the care of people with osteoarthritis, stroke, and there are people in our school working on such things as end-of-life care. There's also a great deal of concern in our school for people from vulnerable populations, minorities and other kinds of challenges for people. You'll find if you were to look closely at our research, you would see a thread in that area. It will be my pleasure to contribute to the training and mentoring activities for the program, the grants programs. The only thing is, Dr. Mayer did not tell me about the wintry meetings, even though they are such fun. I think our meeting is this afternoon at 3 o'clock, so maybe it won't be too wintry at that point. The end result of all of this collaboration across our schools and the campus will be an interdisciplinary network of highly competent healthcare researchers who can identify novel ways to partner with patients and enhance health outcomes. Thank you.
Thank you, Janet. Next, it's my pleasure to introduce Dr. Vicki Kahn, who is the Potter Brenton Distinguished Professor and the Associate Dean of the University of Missouri Sinclair School of Nursing Office Research.
Thank you. The School of Nursing is delighted to combine strengths with our Mizzou colleagues to design and conduct research that will improve patient outcomes. Because nurses spend so much time with patients, they're traditionally very concerned about the outcomes that matter most to patients and to their families. Patients may value quality of life and independence over the traditional clinical outcomes that healthcare providers tend to emphasize. The focus on various care transitions is an especially exciting part of this project. The nurse-led project in the PCORI grant will implement and evaluate care coordination for the transition from skilled nursing facilities to home. Lori Popejoy is leading that project. Her colleagues working with her include Bonnie Wakefield, Amy Vogelsmeyer, Marilyn Rance, Colleen Galambos, and of course, David is everywhere. Where is he? This is a vitally important transition for study because we have an expanding number of older adults with many chronic illnesses that have very complex care demand needs. Successful interventions to improve outcomes in this population are very important because of the vulnerable nature of the population. We anticipate many other nurse researchers will become involved in the grant, building capacity aspect of this grant, beyond just completing studies, building skills for future grant work and future studies. The School of Nursing is delighted to be active participants in this important interdisciplinary activity.
Thank you, Vicki. So last but not least, I'd like to introduce the man of the hour, who is Dr. David Meir. Dr. Meir is the William C. Allen Professor and Director of Research of the Curtis W. and Ann H. Long Department of Family and Community Medicine at the University of Missouri School of Medicine. David.
Thanks. And is this, yes, obviously this is good. So Dean Hall, Dean Kahn, Dean Farmer, Glenn, and Chancellor Owens, colleagues and friends. I'm really thrilled to be here today to discuss our new grant from the Agency for Healthcare Policy and Research and Quality to support patient-centered outcomes research. This is really a high point for me in my career. As we all know, healthcare today is very complex. We have multiple providers and health systems. Patients and healthcare providers are bombarded with information about the latest advances in medical research and treatments. At the same time, because people are living longer, we are seeing more patients with multiple chronic diseases. In this environment, how can we help patients and providers know and understand which prevention, diagnosis, and treatment options are best for each individual? The research grant we are announcing today will establish a foundation of multiple types of patient-centered research at the University of Missouri. Our ultimate goal is to help give each patient a stronger voice in his or her healthcare decisions. To that end, we'll place a very strong emphasis on involving patients and other stakeholders in framing our research and interpreting our findings. We will train investigators in the process of engaging patients as not only participants, but advisors in research. And Glenn gave you some information about one of the major tools which we're proposing to use to help with that. In addition to its potential to improve patient outcomes, this grant is very important for another reason. This $4.5 million will lay the foundation at the University of Missouri for multiple patient-centered research projects across many disciplines, including nursing, journalism, health professions, and social work. It will expand the capacity of the university to focus on improving outcomes for patients everywhere. It will help us to train future investigators and increase our capacity to use resources such as large data sets. Over the next 5 years, we're going to be conducting, as has been mentioned, 3 targeted patient-centered outcomes research projects. The first project will compare whether open surgery or less invasive procedures done through arteries are more effective at saving limbs and avoiding repeat hospitalizations. We will use Medicare data and data from hospitals that, like MU, use Cerner electronic health records. Results will help physicians and patients in deciding which approach best matches a patient's preferences and needs. The second project will test ways to improve the discharge process of those returning home from skilled nursing facilities. Many older adults will spend time in a skilled nursing home for rehabilitation after a hospitalization. Critical follow-up can fall through the cracks when a patient transitions from a hospital or a nursing facility to home. For example, if the patient's on an anticoagulant, something that's really quite common, commonly called a blood thinner, arrangements need to be made for monitoring the use of this medication to avoid either overtreatment or undertreatment, which can result in the first instance in bleeding or in a dangerous blood clot. Either one of those can result in an unplanned rehospitalization, which can inhibit someone's recovery. Excellent communication between the nursing home and outpatient providers is essential to avoid problems like this that could precipitate a new hospitalization. Our final project involves a study related to chronic pain management. We'll be studying multiple primary care practices to improve decision-making concerning the prescription of opioids for chronic pain. This is a particularly pertinent topic because nationwide there is increasing concern about problems with prescription narcotic pain medicines. I'm thrilled to be leading this project and working with many talented investigators across the health professions and the campus, many of whom are in the room with us today. MU is remarkable in providing a welcoming climate for such complex interdisciplinary projects. And I have no doubt we received this grant because we created an integrated program of talented researchers across the campus with expertise that's relevant to patient-centered outcomes research. The infrastructure and support from our nationally ranked Department of Family and Community Medicine and the strong clinical patient care environment of MU Healthcare were also crucial. Many people put a lot of work into our application and will put a lot of effort into carrying out our work. Without diminishing important help provided by others who I'm not going to name, I want to particularly acknowledge Robin Cruz, Doug and Bonnie Wakefield, Glenn Cameron, Lori Popejoy, Dan Vincent, Todd Vogel, Tracy Turner, Matt Levins, Sherry Schubert, and Cynthia Hayden. We could not have succeeded without a lot of effort on the part of all these people, much of which had to go on during the holiday season a year ago. I also want to acknowledge someone that I wasn't sure was going to be able to join us today, which is my wife, who was very tolerant during the last holiday season with a lot of long hours that I put in and having to cancel plans for a winter vacation. So to conclude, patient-centered care research represents a terrific opportunity, and we're hopeful that many MU faculty will be interested in participating and will join us in this effort. So I hope to hear from many of them, and thank you very much.
Thank you, David. I want to express my appreciation to all the speakers today for helping to tell the story of this wonderful grant. And I want to just echo what David said. Projects of this magnitude don't happen on their own. They take, first of all, vision. They take tremendous dedication and hard work, and hundreds and hundreds and hundreds of hours of work have gone into this, not just from David and the people up here on the platform, but from many of you who are in the audience and from others across the campus. So I think we ought to join one more time in congratulating the entire grant team that has helped bring this together by expressing our appreciation. Lastly, I want to thank you for being here today to help us to celebrate this, this truly celebratory moment. This is the kind of Christmas gift we would love to have every year. And please hang around for a while to visit with our grant team, to congratulate them, and to enjoy the refreshments and to enjoy visiting with each other. Thank you again for being here today.